Sheriff, I want to thank you for taking some time out of your schedule to sit down and talk about the issue of jail deaths. And I wanted to start big picture. There have been more deaths in your tenure. In the last 5 years, there's been a spike in deaths. Why is that?
We are America. America has changed. My jail detention center is no different from across America. The real question is, what are we doing about the spike of fentanyl? What are we doing about the real spike of mental health illness? What are we doing about the spike of substance abuse? What are we doing about the spike of holding people incarcerated while waiting for court? All of those things assist with deaths inside detention center. So let's make it clear. Mecklenburg County is not unique in that way of death. We are unique in taking care of people, and we are unique in helping people, but that's the only uniqueness that we have to all of the deaths around the state.
There's been 18 deaths in 5.5 years. That's more than double either of your predecessors. And if you want to compare to the rest of the state, Wake County, which has 2 detention centers, but is close in size, close in capacity, they've only seen 11 deaths in that same time period. So again, why that spike in deaths?
Well, we have the largest population in the state. Maybe we have the largest homicide rate. Do we ever look at that? Do we have the largest death rate? Do we have the most shootings than any other state, any other counties? So we simply want to signal out Mecklenburg County, and that should not be the case. It is an epidemic across this nation. So I can't tell you what Wake is doing. I can't tell you what other people are doing, and I can't tell you what my predecessors did, but I can tell you what my predecessors didn't do. They didn't talk about mental health. They didn't talk about substance abuse. They didn't look at suicides the way that I looked at them. I'm doing more than my 2 predecessors together did about mental health.
Then why are there more deaths?
Well, you can say this. Why are there more substance abuse? How many more deaths at Carolina Medical Center? How many more deaths at Novant? How many more deaths in the city? You want to single out Mecklenburg County Detention Center for whatever reason. That cannot happen.
You've talked about epidemics of drugs, and I want to address that. Overdose deaths in the jails, in the Mecklenburg County jail. If people are dying from overdose in the jail, how are drugs getting inside of the jail?
Drugs come into jail like anybody else, through mail. We've tackled that issue about drugs coming through mail. Did my predecessors did it? Absolutely not. We created a better system for fentanyl not to come into jail because we have a scanning system. Is it going to 100% stop it? Absolutely not. Are we doing better? Absolutely.
How do you define better?
Better means that we have less.
Less what?
Less drugs coming inside.
Do you know how many people have died of overdose in the jail under your tenure?
Tell me.
There's been at least 4, according to lawsuits. There's been others that are attributed to natural causes. There's been suicides. Do you know how many?
Yes, I do. But you're going to tell me how many also. So tell me how many people die every day in Charlotte of a drug overdose. Tell me how many people have increased the death rate how many states have increased the death rate across the state, across this nation, of fentanyl. Fentanyl was not even existing during the time of my 2 predecessors, but fentanyl does exist now. Mental health existed with my 2 predecessors, but I immediately did something about mental health. I'm immediately doing something about drug overdose. And I'm sure you can't tell me what my predecessors did.
Sheriff, we're not talking about your predecessors. I'm not interviewing your predecessors. I'm not talking to the city of Charlotte. I'm not talking to other agencies about their issues. We are here to talk about the jail. And so in terms of overdose deaths, when a resident is inside the jail, how are they accessing drugs that allow them to die from overdose?
Well, let me explain. If you don't know, drugs come in many forms and fashion. Drugs can come in under a stamp. Drug can come into the cavities of your bodies. Are we foolproof? Absolutely not. Are we doing better? Absolutely. Drugs will come anywhere. How does drug get into the United States? How did the drug get into your community? How do drugs get into homes that we believe that should not come into, but they still do? So you're asking me the absolute. We cannot stop drugs from coming in the United States. As everybody well knows, it's been coming in since before you and I. So we can't completely stop it, but we can deter it. And we have deterred drugs coming inside the Mecklenburg County Detention Center.
When people die of an overdose, there's symptoms that precede that death. Are staff trained to check for those symptoms and alert medical staff in that situation?
Staff are trained to respond. We're not a medical facility. We wish that the community would do more involved, so we will not have residents coming inside with substance abuse. My staff deal with years of substance abuse. Years. And so we do the best that we can. Are they trained to observe and document and record? Absolutely. And that's what we do.
Do your staff bear any responsibility when a resident dies?
The responsibility, we'll let the courts decide that.
How long is an acceptable time for a staff member to see symptoms? How long is the acceptable time between an observance of symptoms and the administration of Narcan?
My staff, when they observe it, they respond. I don't think that you'll find any other detention center in North Carolina is doing what we're doing about Narcan. How many people have Narcan machines inside their facilities? How many have Narcan machines inside each pod? We're doing it. We're going to respond. My staff saved lives here.
I'm representing 18 families whose loved one died without their life being saved. So yes, there have been lives saved, but for those who died of an overdose, who were experiencing symptoms for hours before their death, who didn't receive Narcan until they stopped breathing, I'm here representing those families. What is the acceptable amount of time, specifically?
Well, I'm representing 1.2 million people that are always responsible for it. Are we representing the families before they get here? Are you representing the families who have substance abuse before they enter my facilities? Those same families, are you representing them? The 18 families that had prior drug behavior before they got here, that we have to take care of? That we are not a medical facility, but we have now act like the medical hospital of Mecklenburg County? My staff responds, and they respond well. I will not let someone say that my staff does not respond to someone in a drug crisis when we observe them.
What is the acceptable amount of time between observing symptoms and responding?
Immediately after you observe, you respond.
So let's talk about that observance, because there are allegations that the hours are going by before that response happens.
Well, we're going to take care of that when it comes to court. I'm not going to speak on any allegations at this time. We will answer and have a response for that when it gets to court.
That's perfectly acceptable. When staff, have you ever had an instance where you learned that a staff member did not respond within what you see as an acceptable amount of time?
I can't answer that.
Why not?
Because I don't know.
Why don't you know? You're the head of the jail.
I'm the head of the jail. No, I'm the head of the detention center. Have I seen that paperwork? I will review that when it's time to come to court.
So you don't know right now, over 5.5 years of tenure, whether any of your staff members have not responded appropriately.
You didn't ask that I stand 5.5 years that my staff absolutely respond appropriately. I wish that we can prevent every death here. I wish that my staff responds with life-saving measures every time, which they do. Can we save somebody in the crisis? We don't have the medical, this is not a medical facility. How many people die at Carolina Medical Center and Novant daily with all of the medical staff and providers there? Have we asked them why people are dying there? No. We want to target Mecklenburg County Detention Center. So I will not let you all sign about this or put my staff in a position that we're not doing our job. You represent the 18 people. I'm glad that you represent those 18 people. I represent 1.2 million people. I wish I had those 18 families under my tenure to say, can we fight the drug abuse before they get here? That's what I wish.
But your job is to fight it after they get here.
No, my job is to fight it daily, not after they get to fight here. My job is even to fight it in the community, but the community needs to work with us to do that. Are we going to stop drugs? Gary McFadden, the sheriff, cannot stop drugs, not just me. That's the problem that we're having. You believe that I'm a single person that can stop it. I can't. It takes the community. Prior coming here, why don't we fight the substance abuse prior to coming here? And we won't have to worry about when you get here. Fight it prior to you getting here.
Do you accept any responsibility when a resident dies of an overdose in the jail?
Do I accept responsibility? That I have something to do with their responsibilities of them dying? That's what you're asking me? Do I cause their death?
No, sir.
Can I prevent their death?
I ask if you have responsibility
As
over
the
the
Sheriff of
policies and the staff members
As the
that
Sheriff of
protect
Mecklenburg
them.
County, that relies on me. Custody and care relies on me.
So then again, I ask, over the last 5.5 years, are you aware of any staff member ever exhibiting a disregard for a medical need?
We will answer that in court.
Okay. Let's talk about safety checks.
Sure.
You've made very clear in your position over the last several months that you believe there's a difference in how you calculate them versus how the state calculates them.
Absolutely.
Have you had conversations with the state
Absolutely.
since the April press conference where you accused them of lying?
No, I didn't accuse them of lying. I said that they were lying. Let's make it clear. You or no other reporter actually reported that he lied. He actually lied before my staff. He actually lied before my attorneys. And I still sit here today and said, Mr. Charles Brown lied. That is what we need to be talking about. How can we trust somebody with jail inspection if they are untruthful? As you would say, if the sheriff was untruthful, I would be on camera saying, Sheriff, did you lie? No one has interviewed Charles Brown about his untruthfulness.
My question was whether you've had conversations with the state since that April press conference.
And yes, I have.
What's been the substance of those conversations?
Confusion on the state's part.
Is the jail or the detention center under investigation from the state?
No, it's not.
Okay. So when we talk about safety checks, and leaving aside that I understand that tension right now between you and the state DHHS.
Well, let me correct that. There's
Sure.
not tension. There is understanding. There is understanding. Make sure we get that and not a soundbite. It is an understanding. The state is very much willing to work with us. They very much understand where the discrepancies are. The North Carolina Sheriff Association saw these discrepancies years before this. And so we have an appeal process that we had to put in place in the last 3 or 4 years because we saw that it is not exactly how it is supposed to be. Why? Because no jail is inspected the same. No jail has the same process of tours. And so that has now become a topic of discussion.
When staff are conducting safety checks, do you require that they visually see every inmate within their supervision for
Yes.
every safety check?
Yes.
And how often are those safety checks by state law supposed to happen?
Every 15 minutes.
Okay.
Every 15 minutes if somebody's in special custody, every 30 minutes if somebody's not. Do you know how many inspections we have per day?
Upwards of 2,000.
Up to 2,000 a day.
Have you learned at any point in your 5.5 years that a safety check did not happen in the way that you just said should happen? A staff member laying eyes on an inmate in their supervision.
It is now a discrepancy between me and the state. We have 2 methods of making sure that they are done. The state may be only looking at 1. We have 2 methods. And so now they're understanding that our methods are not like anyone else's methods, and we have 2 methods.
Are those methods working?
Absolutely. The methods are working to us, but does the state inspector understand those methods? And that's the problem that we're having now. They're having problems with counting those methods.
But in every death, except for the one in January, and the ones haven't been released yet for March, so I'm not talking about 2024 deaths, but in every death for the prior 3 years, it was listed as an issue in the state reports that people who died, they were not getting that visual check that could have alerted them to symptoms being displayed.
Well, it should be because the state inspector lied to me, so why wouldn't we say he lied then? We haven't figured that out. If he lied then, with us recently, why are we saying that he couldn't lie back then?
So every safety check has been completed properly
What
for a
I'm
death?
saying to you is, it's a discrepancy. I cannot trust the report.
Do you believe from your staff that every safety check was completed properly before a death?
I believe my staff is doing a great job, and I believe my staff doing the best of their ability to do the safety checks. Can I say 100%? I'll leave that to the courts.
One other thing I wanted to touch on, and we've talked a lot about your staff. Have any staff been fired in the last 5.5 years for an issue related to not responding to medical need?
Not to my knowledge.
You have not fired anyone for
Not
that
to my
purpose. Have any staff members of yours been fired for bringing drugs into the jail?
Absolutely.
How many?
I can't tell you how many.
Can you ballpark it for me?
Can't tell you how many. I'm not going to guess for the media.
That's fair.
It's fair.
Is it 1? Is it 10? How?
I'm not going to
I am
guess.
looking for an estimate.
I can tell you that later.
Okay, that's fair enough. I'll put in that information request. We've covered a lot of ground.
But we haven't covered the actual ground that we need to cover.
All right, what would you like to cover?
Let's talk about mental health. Have
Let's
we
talk
talked about
about it.
mental health? Have we talked about substance abuse? What causes deaths inside the detention center? How hard it is to regulate what goes on the outside. See, we want to spin this as Mecklenburg County Jail is a bad jail. It is absolutely not a bad jail. It's not a bad detention center. If you look around the state, we're one of the best. We have jails closed. You understand that jails have been closed and insurance away have been taken away because of jail deaths. Are we reporting about that? No. We want to single out Mecklenburg County. We will not let you single out Mecklenburg County. When the jail inspector lied to us, that should be the story. That story wasn't never produced. That story has not been produced. A Mecklenburg County jail inspector who we rely on has lied about inspection. So how truthful can we be? How accurate can we rely on those records if you make up a story and you lie about it?
Sheriff, you know as well as I do that I ran that story that day, and that legally, you know very well that legally I cannot say someone lied, and I have to say it as an allegation of lying. You know that.
Well, you could say that, but did you do a thorough, in-depth, well-balanced story? Absolutely not.
I'm not interviewing the DHHS.
I
I'm
know you're
interviewing
not.
you.
You are interviewing me. You are interviewing me. Have you talked about how great Mecklenburg County detention centers are when we talk about our predecessors? When my predecessors saw the suicide rate go up, did we talk about the suicide rate go up with my predecessors? Absolutely not. When you came about the predecessors, did we talk about the death rate and suicide rates? Absolutely not. Did we talk about mental health of my predecessors, about their deaths? Absolutely not. What did they do about mental health? Nothing. I created 2 mental health pods. Now I have the state-only RISE program that helps people inside with mental health. So when we talk about deaths, we or you or no one else can stop death. If it is, you have God's ability. We deal with people who have chronic illness in the community. When you say, instead of soundbite, have we talked about community health? Have we talked about what has not been health providing has been restricted to the county? Is that a contributing factor of people coming inside? How many more people have to wait to be released because of COVID? When we talk about the average stay of the detention center, no, let's talk about all of it. Let's talk about how many people are waiting 4 and 5 years to go to trial. So we also want to simply say apples and oranges, 18 and 19. Have we talked about fentanyl? No, we just touched on it. How it gets inside? We just touched on it. So we want this to be about the 18 deaths the families that you represent. Well, what about the families previously are you representing on gun violence? Are you representing them? Are you representing all families inside Mecklenburg County with all deaths? No. We just want to talk about something that we can highlight. Death inside Mecklenburg County Detention Center. And so, let me finish. So let's talk about all of them. Let's talk about mental health. What has the previous sheriff done about mental health? Because my predecessors, as you say, more than anybody else. What has my previous predecessors did about mental health? We don't have those answers. What do my previous predecessors did about suicide? We don't talk about this. We want to talk about 18 deaths. I talk to these families. I help these families recover. I help these families get a better part of life. I take family members home. I take family members to the crime scene, as you all call it. But you ask the jail, when we go back to the jail inspectors, have the jail inspectors did their job? Have they reviewed all of the files of these 18 deaths about these tours? Absolutely not. Have they reviewed the videos of these 18 deaths that you represent? They have not. So when we're talking about this, let's don't single it out as though Mecklenburg County Detention Center is a bad place. We are a correctional institute. We take people in who have never even seen the doctor. We have people die here because of chronic illness. We can't stop ovarian cancer, and we can't treat ovarian cancer. We can't treat colon cancer. We can't treat hypertension. All of that comes inside here when we talk about these deaths. We simply want to pick these deaths on a tour that we can't be accurate about because we can't trust the files. Why? Because they lied. That should be the story. A jail inspector was untruthful. Well, if you ask the jail inspector as you ask me directly, jail inspector, did you lie? Or you ask them, here's a good question, did you suspend the jail inspector? Did you fire the jail inspector? Or did you discipline the jail inspector who created records that never exist? All of that is a contributing factor to the criminal justice system that the 18 families are still subjected to.
Why are you deflecting responsibility in this
I'm
interview?
not deflecting responsibility. I take my responsibility. I never deflect responsibility. That's why I ran for office the second time. I don't run away from this. This is my 43rd year in law enforcement. When we're talking about death, you're talking to someone who's never, ever lost a homicide case in the Mecklenburg County or the U.S. So when you're talking about death and death investigation, you're almost talking to an expert of how things are supposed to be. Can I stop drugs from coming inside? I can deter it. That's my responsibility. Can I give people the best custody and care? That's my responsibility. I'm never going to deflect my responsibilities.
So if 18 deaths in your tenure is, in your view, a normal number of deaths, what is the unacceptable number?
There is no normal view for death. There is no normal view of death. A normal view of death, you're going to say, what is the normal view to accept someone dying of the 18 families? You should ask the 18 families, what would be acceptable? I take these 5 and not your 5. Death is not acceptable under no means. No view of death is acceptable to me. I'm a homicide detective, ex-homicide detective. No death is acceptable.
So when I ask, why is there a spike in deaths? And you say, I represent 1.2 million, not the 18 families, which is what you said.
Let me make sure you get that correct.
Please.
I represent the 18 families because they are members of my community. They are members of my community. Should I represent these families prior to this? I wish I did. Then I can tell them about substance abuse. I can tell them about mental health. I can tell them all of that. I didn't have that chance. I wish I had that chance. I have that chance now with the people that I have remaining here, and they get that chance. We do our job, but do not make it seem like we're not. Do not make us single out. Look at the other sheriff's offices across North Carolina. Look at Rockingham County. They lost their license, they lost their insurance because of jail deaths. Past administration, people jumped off of the ledge, came in after being treated for mental health, miscommunication. Do you represent that family?
People have hanged themselves in the jail under your watch.
People have hanged themselves across the United States. People have hanged themselves under the predecessors. People are going to continue to hang themselves. Why? Because of suicide. Why? Because of depression. Why? All of that happens before they get here. All of what you're talking about happens before they get here. Suicides will continue across America. If you or anybody else has a remedy to that, we will listen. We know about suicides. Predecessors prior to this, they talked about an increase. They talked about the increase in suicide. Did my predecessors do anything about mental health? Absolutely not. What did I do? I came in and created an avenue to help you. I can give you one before you leave. My staff now personally talks to people. Always have talked to people. We take that a little bit more measure to say what really happens. A mother will tell you, I allow her son to talk on the phone, and we work through it. So what are we doing? We're hoping to prevent another suicide. Can we stop suicide, or you can stop suicide? I would love to hear that, because nobody has that answer. Nobody's God.
You mentioned the 18 families and that you represent them.
You represent them. You said that you represent them. I represent 1.2 million people in the city as their sheriff. I never single out 18 people. All 1 million, 0.2 that I represent.
But that includes the 18 families.
Absolutely. They're under my custody and care.
So why hasn't the family of the man who died this year, this January, of overdose in the jail, why haven't they heard from you?
This is a legal matter. If you know anything
There's
about,
no lawsuit in that death.
If you know anything about legal, they're here for me the night that it happened.
They have told me they did not.
Well, you have to take up that with them.
And that's the question they want me to ask you, is
Right.
why they didn't hear from you.
And you find your answer there.
Okay. Do you have anything you want to add?
No, I just want you to be a fair reporter. I want you to have balanced reporting. You came here and walked through the jail and you never asked a question. You had time to ask a question. You had time to ask many questions. You could have went through the whole, but you stood back. Why not come up and have the questions then? Why wait to put all these things on the paper, tap on your desk and tell us about these reportings? Why don't you do fair reporting? Why don't you do honest reporting, a full reporting? And that's the same thing I'm asking DHS. When you're looking at a death, come to the scene. Tell the family that, tell your 18 families this, that during their death investigation, DHS does not review the videotapes. During their death investigation, DHS does not go to the place where the person dies. DHS does not take all of the files. They selectively take those files, what they want out of it, and make a decision. You can tell them that. Is that a thorough investigation that they do? Absolutely not. Why? Because I've been investigating deaths for over 20-some years. Would I accept that as a death investigation on inspection? No. Simply just looking at numbers and papers? No. Ask questions. Do they interview staff after the death? You could tell your 18 families that DHSS does not interview the families after any death. DHSS does not review any videos after the death. They simply take a piece of paper, take pieces of paper out of the notebook and take what they want to make a decision that causes us to have these type of interviews. Would I want better? Absolutely, for those 18 families. And I will meet with those 18 families, because here's what the Sheriff McFadden, and you can report this. Prior to me coming here, of all the death that happened prior to me coming here, I interviewed every single family member of all the deaths prior to me coming here. Why? Because I want to know. I want to know what they needed to know and what I needed to know. Will I talk to my 18 family members? Sure I will. But not under the rim of a media coverage or a lawyer. I want to talk to them personally. Ask one of those 18 family members how they got home that day. Ask one of those 18 family members, didn't they get a call? Ask any of those family members, didn't they speak to the sheriff? Did we give them the death notice? Haven't they heard from us? All family members? How many family members are we talking about? A cousin, an aunt? Maybe not.
I'm talking about the mom and the sister.
Maybe. But will I talk to them? Absolutely.
This is 7 months later.
Okay. How were they notified? Were they notified by us?
I'm talking about you.
Okay,
they didn't get a call from you.
I'm asking you, have they been notified by us?
Why aren't you answering the question?
Why aren't you answering my question?
We're at an impasse.
We are.
I'm not here to be interviewed.
But I'm here to defend. I'm here to defend my name, and I'm here to defend my honor. And I will not let anybody tarnish that. I have a great reputation in the city, and I will not let a story for ratings ever tarnish my image. I'm one of the sheriffs that talk to most people. I'm more accessible than any sheriff has ever been in this city, and continue to will be, and I will always stand on that. If you want to take one family that says, hey, wait, he didn't call us, well, how about interviewing the 825 other families that I have been involved in? Missing one family, maybe a phone call. So we're going to dance on one family? Absolutely not. I will not allow that. Will I talk to this family? Absolutely. When all the smoke blows over like everybody else to make a story. This is not about a story. Will we stick with that family years from now? Sure we will. We don't do it as a news story. We do it as a profession and an honor.
So it's acceptable for there to be a 7-month delay in talking to the family of a resident who died?
It's acceptable for who? Do you know the boundaries? Why or why not? No, we don't know that. We don't know that. We're just assuming for a news story or a soundbite.
What am I assuming?
You're assuming that Mecklenburg County Detention Center is allowing people to die. You're assuming that we are uncaring. I will not have you tarnish my name that I don't care. I'm one of the most compassionate sheriffs ever in the history of this agency. You can't go out in the street and say, Sheriff McFadden, not compassionate. Please don't go down that road. Absolutely not. I take pride in what I do. I've been honored in the city because of my community engagement, because I involved with the community. Did you know that the President of the United States just gave me a Lifetime Achievement Award for my community service and involvement? And it may not include the 18 family, but they're part of this community that I'm a part of.
So I go back to the original question. Is it acceptable for there to be a 7-month delay in you speaking to the family of a resident who died?
Under what grounds? Why was it a delay? Do you know why it was a delay? Do you know why they said, I may not want to talk to you? What family member? What family
The
member?
mother and the sister.
And she hasn't heard from anybody from Mecklenburg?
She hasn't heard from you.
Because here's why. Here's what we do. We tell them that the case is investigated by the State Bureau of Investigation. That is an investigating agency. That is an investigative agency.
That's your response for
No,
delaying to talk to the
you asked me
family?
a question. That's their investigative agency. I'm not going to tarnish their agency. I'm not going to speak against the agency, which is a fine agency. I will talk to this family. I will make it a point to talk to this family since it's such a point that you're making here.
Okay. I've completed my questions. Do you have anything you'd like to add?
No, I just want you to be a fair reporter.
You mentioned that.
I know, but are you going to be?
I'm not here to be interviewed, sir.
No, but I'm asking questions. It's hard to ask a direct question. Are you going to be a fair and balanced reporter? Because that's all I'm asking. I don't want to fight with anyone, but I want fair and balances. Here's reports that we have looked at. When we talk about predecessors, let's ask about them. Let's ask about them, but we don't. I take pride in what I'm doing. I don't want to fight with nobody, not even your radio TV station. I love your station, but some things just don't set right. You have plenty of time to talk to the sheriff instead of saying he rejects the interview. That's not fair.
Are you referring to when you canceled an interview 3 months ago?
Well, you canceled one too. You canceled this week because I said, let's talk today. And you said you couldn't.
I'm sorry, what?
Yes, the day that you called for this interview, I said, let's talk today.
I was not offered an opportunity. What I was told.
I said today, let's talk today. You said next week.
I was given, I am not, your spokesperson told me in a phone call, he had not talked to you yet, but that the availability could be today or the following week. I told him at the time I was out of town or unavailable that day. I don't recall the exact words because it was not a recorded phone call. I did not have availability that day, so we scheduled for this week.
And I accept it.
Great. I appreciate you taking the time
Well, let's talk
to
about
sit down
that.
and talk.
We're having a it don't have to be, let's have a casual conversation. You could talk, because Sheriff McFadden would never run from an interview. Because see, here's what we don't do. We don't run from what my job entitles. But here's what I don't like. When people miscategorize what I was doing not to take an interview. And that's what I think. Wording is very important, as you see it here. When we talk about it, you see that wording is very important. I asked for a balanced story. I asked for somebody to say, we gave you that story to walk through the jail, and you could ask any question. You didn't ask a question about how is it done. When they were showing you how it was done, you stood back and asked no question. You could ask many questions there. Why not? Because that's not important.
Why are you deflecting responsibility again?
Why are you reflecting your responsibility as a reporter?
I'm speaking to the head of the agency
And I'm speaking to the reporter.
about 18 deaths
Right.
in your tenure.
Sure.
And you have sat here and deflected responsibility to me, to the state, to your predecessors, to the community, to the issues that happen before the residents get to your detention center.
No, I'm talking about causes that help people keep on having drug use. I'm talking about mental health. Think about this. They don't get mental health when they arrive in this door. They are subjected to violence before they get here. They are subjected to all kind of things before they get to Mecklenburg County Detention Center. Whose responsibility is that? That's the community that you are part of. My responsibility after we have received these people, mine is custody and care for court. You want this story to be about me deflecting my responsibilities. It's not going to be that. Because we are a custody and care center. We're not a hospital. People die in a hospital under doctor's care, under doctor's watch, and they go for appointments, and they go for rounds, but people still die in the hospital. Do we hold them responsible for the deaths inside the hospital? Do we? No. We just say they died of that cause, or they died because they came here. Think about that. You want to say because of Mecklenburg County Jail, should we hold all doctors for the responsibilities of those deaths inside the hospitals? Should we hold firemen for the deaths inside of a firehouse? Inside of houses on fire? Should we hold EMS for the responsibility of taking somebody from the car? See, we talk about deflecting responsibilities. Are they supposed to save people? Are they supposed to rescue people? What about the community? Are we supposed to let people be on drugs and then say it is deflecting responsibility of the sheriff? No. No, it's bigger than that. And that's what I'm trying to get you to understand, like everybody else. We want it to be about the sheriff and the 18 people dying. The 18 people dying. What about the hundreds and hundreds of people incarcerated? Are we responsible for them? Are you care about those families? You care about the family member who's been over here for 10 years? You care about the family member who's trying to commit suicide 2 days ago and we saved them? That's a responsibility. We saved 2 people. Who's talking to those families? I am. Who responsibility to that? That is me. And that's what we want you all to understand. Don't let it be a story about ratings or sound bites of reflection or deflection. Let's talk about the real issue. The real issue is substance abuse, poverty, education, nutrition. All of that is a contributing factor to these deaths in the detention center. Whose responsibility is that?
In the 5.5 years that you have been sheriff, have your staff ever shown a disregard for medical need?
We will let the courts decide that if we have.
That's the only question I care about.
You shouldn't care. That should not be the only question that you care about. You should say, are your staff under stress? Don't care just about answering that question. Care about my staff too. Do you care about my staff? Do you care about my men and women who worked inside this facility for many years? No.
Have your staff ever shown a disregard for medical need?
Have you shown regard for my staff? And don't say, well, Sheriff McFadden didn't answer the question, because we have it recorded too. So here's what I'm going to tell you. We have lawsuits. You know I can't answer those questions. And I will not answer those questions. But we will see those come out in court.
Then that's where we close this interview.
Well, I thank you. And
Thank
I
you for
welcome
your
you
time.
back.
Thank you.
Open arms. But I wish you come here without the camera one day. And I wish you come and you may learn something, because this is not Wisconsin. This is Mecklenburg County. We're different.
Thank you for your time.
Thank you.